Last time, we learned that reforming the broken healthcare payment system would empower patients to spend more of their healthcare dollars as they choose.
Gosh, Professor, I'm glad we could go to the grocery store. I have a lot of things on my shopping list.
Penny, imagine that you came to the grocery store today to buy everything that you need for dinner tonight, but you didn't know how much each item would cost until the checker rang up the bill.
We wouldn't be getting very many bargains, Professor.
That's right, Penny, and unfortunately, that's what is happening in our healthcare system today. Right now, there isn't much price transparency in the prescription drug market, especially for innovative new medicines that are more expensive. When you don't know how much a drug will cost, the market doesn't really work very well.
And we end up paying a lot more at the checkout stand.
That's right, Penny, but there are other ways that we pay a lot more too. Imagine, here on this aisle, if you could only choose one of the 10 spaghetti sauce options.
I bet we wouldn't get a deal.
That's right, Penny, and that's what is happening with prescription drugs too. We're only able to access the drugs our insurers put on a list called drug formularies. Often, the drugs that are approved on the list are the ones that make industry middlemen called pharmacy benefit managers the most money, not necessarily the drugs that are the least expensive or are best for you.
That's not right, Professor. I'm glad I clipped some coupons to help bring down the total food bill this week.
Penny, imagine if you brought in your coupons, but someone else benefited from all the savings and not you.
Hey, that's not fair.
It's not, Penny, but it's what's happening today with discounts for prescription drugs. Big discounts are negotiated for prescription drugs, and it's insurers and third parties who benefit, not patients. Patients are even paying more for drugs, not less, while others pocket the discounts.
One way we can save is buying the store brand of canned goods rather than the name brand. You save a lot of money that way.
Unfortunately, patients will often spend more money if they purchase cheaper generic brands through their insurance rather than just purchasing these medicines directly.
How do we fix this, Professor?
Penny, your lesson for today is this. By centering the market for generic drugs around patients, we can ensure patients are able to buy low-cost generics directly and save a lot of money on medicine. Insurance can then focus on helping with the costs of really expensive drugs. By improving price transparency, we can end the system's biases against low-cost medicines and also make innovative benefits more affordable. And by ensuring patients benefit directly from discounts, we will save at the drugstore, and insurers and third parties won't pocket our savings.
Join us next time when we learn how we can free providers to deliver more innovative healthcare services.